Welcome to today's program titled A Return to Business, What the Western States Pact Means for Reopening Business Out West. At this time, all participants are in a listen-only mode. For those of you who are logged on to the web presentation, you're encouraged to submit questions throughout the conference by typing them in the text box on your screen. For those interested in obtaining CLE credit for this webinar, an attendance verification code will be read during the presentation that will be required on the CLE attendance affirmation form. Please write this code down. It will not be reread, and it is required for CLE credit. Copies of the webinar recording and materials will be distributed to attendees in the days following this webinar. And now at this time, I'd like to turn things over to your host, Helen McFarland. Welcome, Helen.
Thank you. Good afternoon, everyone. Welcome to our webinar about the Western States Pact and its impact on the reopening plans of its member states. I'd like to start first by introducing our panelists. We have Chantel Egan, who's a partner in our San Francisco office, Elizabeth Levy, who's a partner in our Los Angeles office. I am Helen McFarland in our Seattle office. We have Tim Hoppy, who's an associate in our San Francisco office, and we have Shireen Wetmore, who is an associate in our San Francisco office. Just a brief agenda of what we will be covering today. We're going to talk about the Western States Pact and practical considerations for reopening, including a return to business accommodations, to public accommodations traps for retailers and other businesses, avoiding potential wage and hour risks for reopening, and compliance tips and traps under the Families First Coronavirus Response. So, in the next hour, we will be providing a high-level overview of the guidelines and requirements for reopening businesses on the West Coast, along with some practical guidance to consider as you bring employees back to work. However, please keep in mind that there is no way to answer all of the questions in 1 hour, and any of us would be happy to discuss specific situations with you after the webinar. We're also going to be offering a live poll on hot topics that we have been encountering so you can see what other employers are doing as they navigate these uncharted waters. When we open up a poll, the box with the question and selections for your answers should appear on the right-hand side of your screen at the bottom, underneath the question and answer box that is currently showing. You can select your answer, submit it, and we will be able to immediately view the percentages of each response. We will inform you when we open each poll and when we close, and as soon as the polls are closed, we can announce the results. We're going to start with what is the Western State Pact. Just over a month ago, on April 13th, the governors of Washington, Oregon, and California announced their intention to work together to reopen their economies, noting that health outcomes, not politics, will guide their decisions. They outlined 4 goals, which are 1, to protect vulnerable populations at risk for severe disease. This was directed to nursing homes and other long-term care facilities. 2, to ensure an ability to care for those who may become sick with COVID-19. 3, to mitigate the non-direct COVID-19 health impacts, particularly on disadvantaged communities. And 4, to protect the general public by developing a system for testing, tracking, and isolating. Colorado and Nevada joined the Pact on April 27th. County governors have expressed their desire to work together and share best practices, and representatives of each state meet weekly. While they have taken some joint action, such as requesting $1 trillion from the federal government, their coordination appears loose, advisory, and mainly symbolic. Each state is formulating its own plan to reopen, which varies from the other. However, all of the plans have phases. An analogy we like to use to explain these phases is one for learning how to swim. In phase 1, the lifeguards are on duty and you're getting ready to get into the pool. In phase 2, you put your toe in and work up to walking in the water, but your feet remain on the ground. In phase 3, you put your head in the water, but stay close to the edge of the pool. In phase 4, you're finally swimming. At any of these stages, you might slip backwards, fall in a mouthful of water, have to jump out of the pool, or just be relegated back to the shallow end. States are working to reopen, but any number of issues could cause a setback to bump us back down to a lower phase. So we're now going to briefly examine each of the state's plans. But before we do that, I'm going to open our first poll. So hopefully this will be available for you. And the question is, have you reopened already? The answers are yes fully, yes partially, no, or we are essential and never stopped. So you can go ahead and fill that out, and I will turn it over to Tim Hoppy, talk about California.
Hi, everyone. Thanks so much for joining the call. I am beginning with the state that I guess jumped into the pool first, to continue Helen's analogy. On March 18th, California was the first state to issue a statewide stay-at-home order, which started us down this crazy journey that we're on. On April 28th, the state announced a 4-stage reopening plan, and the state moved through into stage 2 on May 8th. Since that date, it's started to slowly add additional businesses to open that are permitted to open under stage 2. And currently, the stage 2 businesses that are allowed to open statewide are curbside retail, associated logistics, associated manufacturing and warehouses. The state recently added some office businesses to that list, schools, and some personal services such as car washes, pet grooming, tanning facilities, and landscape gardening. The state has a variance process for counties that want to advance more quickly through stage 2. These counties can apply to the state and get permission to open their restaurants for dine-in services and also for in-person retail. 23 rural counties have received variances, but the variances only allow these counties to progress through stage 2. They cannot move into stage 3 and the higher risk workplaces that would be allowed to open in stage 3, such as movie theaters, barbers, salons, and bars. California also has a number of counties with stricter stay-at-home orders in place. So any business that's looking to open shouldn't just rely on the state order, but also needs to move into their local counties as well. Media reports that stage 3 is weeks away. The governor hasn't released any specific criteria for moving into stage 3, but has indicated that he's going to base the decision on data, such as the state's testing capacity, the ability to protect high-risk populations, surge capacity to hospitals, and therapeutic developments. Things, of course, in California can change very quickly, so even businesses that remain closed should use this time to prepare a plan to stay open. And the state has issued a number of resources for industries to use. At least for now, again, things can change very quickly. The state has published requirements that businesses must meet to reopen. These are things like create a risk assessment and prepare a site-specific plan, train employees on how to limit the spread of COVID and screen themselves for COVID, implement control measures and screening, and implement disinfectant protocols. Again, these are the businesses can use the state industry-specific guidance to build out these general requirements. Colorado is another state in the Western Pact, and it is following a similar plan to California. On April 24th, it announced a 3-level plan to reopen and is currently in level 2, the so-called safer at home level, which allows in-store retailers, personal services, including barbers and salons, office businesses, and non-critical manufacturing to open. Like California, stricter local orders can be in place, but they're not as prevalent as in California. And 9 counties have sought and received variances from the state to open faster. And these counties can progress further than California counties with variances. They can open theaters, gyms, and in-person restaurants. 9 counties have been granted the variances, but 64 have requested variances. The California governor, Governor Polis, has announced that he hasn't actually announced a date as to when the state will move into the next phase, but has indicated that on May 25th, he'll make a decision as to whether ski resorts, restaurants, and summer camps can reopen. And on June 1st, we're anticipating an announcement as to whether he'll amend the order to allow for additional businesses to reopen. Like California, Colorado has issued a number of state-specific guidance that can help employers that might still be closed get ready for reopening when the state finally lifts the stay-at-home order more quickly. And Nevada is another state that joins the Western States Pact. On November 30th, it followed California and Colorado's lead to announce a phased approach to reopening its economy. The state, however, has only released details of phase 1, which the state entered on May 9th. In this phase, dine-in restaurants are able to open, barbershops are allowed to open, as are offices, warehouses, auto dealerships, and in-store retail. It permits stricter local orders, but doesn't have a variance process like California and Colorado have. Last week, Governor Sisolak announced that he needed at least 2 weeks of data to determine if the state could move to phase 2, and this will be on Saturday. So there could be an announcement coming, though they haven't made any announcements as of yet. Like Colorado and California, the state has substantial requirements for businesses to reopen. To get those resources, they're maintained by the Nevada Occupational Safety and Health Administration. So their website would be a good place to look for businesses that want to get a jump on the Nevada processes for opening. And with that, I'm going to pass it off to Helen, who's going to talk about Oregon and Washington.
Okay. Oregon's closure on March 23rd was a little bit different from many of the other states. Rather than designating a list of essential businesses that could remain open, Oregon identified the businesses that were required to close. So all of the others could remain open as long as they implemented telecommuting, if possible. And if working from home was not possible, employers had to appoint an employee to establish, implement, and enforce social distancing policies consistent with guidance from the Oregon Health Authority. Policy also had to account for visitors to each business. So on May 7th, when Governor Brown announced the 3 phases to reopen, timing was vague and left to the determination of the governor, but individual counties were required to apply for approval to pass into phase 1 based on specified criteria. Currently, 31 of 36 counties have been approved to be in phase 1 as of May 15th. The 3 largest counties, which comprise Portland, have not yet applied. But phase 1 in Oregon is more than just standing on the side of the pool with the lifeguard. In phase 1, social gatherings of up to 25 people are permitted. Restaurants and bars are open for sit-down service. Salons, gyms, and malls can open. Of course, these businesses are still subject to the requirement that they implement and enforce the social distancing policies from the original closure order. For phase 2, Oregon has not formalized any plans about how it's going to progress. It's unclear whether the counties will have to apply again, what will be open under phase 2, or really any of the details. The only clear information is that there must be at least 21 days in phase 1 before phase 2 can begin. Thus, for at least some of the counties, phase 2 could begin as early as June 5th. An interesting side note in Oregon, the Supreme Court yesterday stayed a lower court's ruling that invalidated the governor's executive order to stay home. So there's some action there in a more rural county trying to get out of the governor's orders. Okay, Washington. Governor Inslee announced Washington's Stay Safe, Stay Healthy order on the same date that Oregon's governor announced hers. So March 23rd. It shows a little bit of coordination even before the Western States Pact was announced. And Washington's stay-home order was more like California's. It designated essential businesses that could continue to operate, but everything else was closed. On May 4th, Governor Inslee outlined Washington's four-phase plan to reopen. It's known as the Safe Start. The governor outlined his expectation that there would be at least 3 weeks in each phase, and phase one was open immediately for the whole state on May 4th. In this phase, outdoor recreation was reopened. Some businesses, including car washes, auto boat sales, landscaping, and existing construction, and non-essential retail is now authorized to do some curbside pickup. For each new category that's allowed, the state issues industry-specific guidance and requirements. So phase two is up next. It's based on the anticipated 3-week plan. June 1st should have been the first date that anyone could have gone into phase two, but apparently some counties have already been approved for phase two. Counties with fewer than 75,000 residents and no new cases of the virus in the last 3 weeks were able to move into phase two. Under phase two, more outdoor recreation is allowed, and you can now meet with up to 5 people outside of your family. They're opening remaining manufacturing, additional construction, in-home domestic services, and retail will be allowed to have in-store purchases. Real estate, professional services, office-based businesses, hair and nail salons, barbers, and pet grooming will be open in phase two. And then restaurants and taverns are going to be open in phase two with capacity at 50% and no table that can have more than 5 people. The state's already unveiled business guidance for most of these industries that are identified in phase two, and those are all available on the governor's website, and each contains specific requirements for each business in order to open. Phase three is going to decrease limitations even further. It's going to allow up to 50 people in outdoor recreational activities and it will open libraries, museums, allow professional sports without audiences, and more businesses. So the takeaway from all of these variances is that you need to plan. That being said, things are changing daily. Washington issued a contact tracing requirement for restaurants, which was almost immediately withdrawn based on the public outcry, and so it's really a moving target. We're going to now close the poll on the first question and publish it. And they are, let's see if I can figure out what they are. So it looks like no one is fully open. We have 23% that is partially open, 36% that is not open at all, and 41% of you are essential and never closed. Okay. So we're going to now turn to Chantel Egan to talk about some practical considerations.
Hello, everyone. As we navigate this changing time, and as Helen said, so much of it is changing quickly, including requirements that are put in place and then are changed, whether they become more onerous or are further limited. Sometimes we also just need to think about, all right, what do we need to do in order to get ourselves ready to open? And what is interesting to think about, especially as we look at those poll results, is some of the things that I'm going to be talking about as practical points are not just about planning to reopen, but for those of you that have already opened partially or have stayed open because you are essential, the expectations that you need to have in the workplace may have changed, and you need to be planning so that you can be able to implement those changes. California has put together a standard for reopening, which really is something that is applicable across the board in terms of generalities. That said, and I'm sure you'll hear this caveat a million times over in this presentation, that it is absolutely imperative as you are putting together your reopening plans that you are looking at the guidance from every level. So you're looking at the state level, you're also looking at the local level, meaning both county and in some areas also cities, to making sure that you are satisfying all of the requirements for each of those locations. And as we can see by the list on your slide, there's quite a bit that needs to be done prior to reopening. And one thing that's in particular is creating a detailed risk assessment and then implementing a site-specific protection plan. And the site-specific piece of that is really important to think about, because if you have multiple locations, while in some ways you may be able to have some generalities because there's similarities, in other places you're really going to have to look at the site in particular and what makes it unique and have a plan and strategy in place. So for example, you may be run an office, but your location in a big city is in a high rise that has a building management and there's elevators and things like that need to be navigated as part of your plan, versus you're in more of a strip mall environment in another part of, even in the same state. So you really need to look at the actual layout of your location in order to put together your risk assessment plan. And while the state of California requires it, I also want to flag that the federal OSHA standards also require that a hazard plan be put together for all of your locations. So for those of you that are thinking, oh, I'm not in California, I don't have to worry about that, this really is a national standard now, even outside the Western Pact. And it's not just about putting together a plan, it's also making sure that your employees know what the plan is and that they are trained in how to, one, protect themselves and protect others against the transmission of COVID-19 as you reopen. But also, if any of your systems or policies have had to change in light of COVID-19 and are in essence our new normal, making sure that employees are aware of those changes. Likewise, also putting in together plans about how to individually screen each of your employees. And the means of doing that, we're going to go into depth in that later in the presentation, can be quite varied and depends, frankly, about your local and state requirements as well as your appetite for risk. Also, just putting together disinfecting protocols as something that you maybe didn't have to think about before, or you had a very benign system of let's say you're a retail establishment and you had a chart in the bathroom that people signed off on once it had been cleaned. You're going to have much more rigorous protocols, and this is not only to decrease the transmission of COVID-19, it's also to help your employees feel comfortable coming back into the workplace, as well as potentially your customers and other people that you're inviting in. And then in doing so, you're also going to be implementing social distancing protocols, and we're going to go into that a little bit more in a bit. The other thing that is really important to think about is, it's not just about creating a plan, it's really also about making sure that there is somebody who is responsible for implementing the plan. And that could mean it's one person, a team of people, and once again, looking at the site-specific requirements that and making sure that there is always somebody on site at each of your locations who is the point person in ensuring that each part of the plan is implemented at your location. And then the other issue I also want to make sure I cover as part of this is that making sure that part of your plan is a what to do if, including you get a visit from OSHA, you find out that an employee has contracted COVID or has been in close contact with someone with COVID, as well as has symptoms. Making sure those what ifs, that you're planning for them so that you have a consistent approach in how to respond. So as part of this, you're going to have to take a close look at your policies. So of course, you're going to be looking at the new legal requirements. For example, in San Francisco, as well as many other cities, there is additional paid leave due to COVID. And you want to make sure that those new laws, and in many instances, they're temporary and they have varying sunset provisions, anywhere from 60 days through the end of the year, making sure that you have policies that accurately reflect those new laws, and then also ensuring that your employees are aware of what those new laws are. In addition, many of these new laws have reporting requirements and making sure that you have a system in place to advise employees as to their rights under these new laws. Likewise, it is absolutely important that you revisit each of your existing policies. In many times, as when working through employers trying to figure out, what to do next, the list can seem so incredibly long. But really starting at the foundation of the policies, the handbooks that you already have in place. In many instances, you can keep them with almost no change at all. The changes are really going to be focused on what needs to change in light of local and state laws, as well as what are things that, we've always, for example, had an in-person consult when someone is going through an accommodation process. Obviously, an in-person meeting is less than desirable at this time, and so providing systems so that people can do things remotely where you had previously had it so that they were in person, and adjusting them to this new normal. And in communicating them to employees, the training piece is really vital. And we need to have a plan for how you are going to push out training. The typical I'll sit in a room and receive a training is, at least for right now, is probably going to be incredibly difficult to implement while maintaining social distancing. So putting together remote training options, whether that's via a video conferencing platform, or actually a pre-recorded movie or something to that effect, so that the training is a video that someone can watch remotely. Likewise, posters that you used to put up in the workplace, while you still want to do that, you also want to make sure that you have a system in place for dissemination of all these materials, so that your employees have copies of them via email or other means, so that they can receive these remotely without having to interact with others. And I should mention too, actually, before we go to question 2, that as part of the training requirements, you really need to make sure that you're taking a close look at the state requirements. So, for example, California requires that a training is done for each employee, and so you want to make sure you are in compliance with that. So here I want you to take a look at what different folks are doing in order to provide their employees, whether it's masks and gloves or protective equipment, to assisting with childcare. There's a variety of things, and we'd be really interested to see what you'd have to say. So that the poll is live, and feel free to mark those answers. I'll publish that in a bit. The social distancing protocols is, we all know the 6 feet. It's now, really ingrained in our mind. But you also have to look at it in a much bigger perspective when you're looking at making changes to prepare the workplace for employees to return. And in particular, actually looking at the workspace itself. For example, if you have lots of shared spaces that people work together, or communal areas, those may need to be closed in their entirety. They need to be reconfigured so that people are at least 6 feet apart. Likewise, places such as break rooms either need to be have only one chair at a table that is 6 feet from others, or frankly just closed in their entirety if it's something that you feel that you cannot enforce. Likewise, also putting in systems so that close contact can be avoided. So, for example, if you typically have, for example, like a mail cart that goes around and you hand each person their mail, instead you may want to consider setting up a transfer station so that individuals can stop by and drop off materials, and then somebody else can come at a different time so that they can maintain 6 feet of distancing and retrieve those materials. Likewise, jumping ahead a bit, part of that shared space is ensuring that we have very high standards for cleaning, especially in anything that's shared, whether it is hallways and restrooms, but also, as I mentioned earlier, those transfer stations where things are coming in and out, as well as developing protocols to minimize high touch equipment. That can be anything from retail, so that you have touchless payment options, as well as in an office setting, limiting the number of people that can use a copier, or assigning only certain people that can use a particular machine. Likewise, you also want to consider protective equipment. In many areas, face coverings are required, with some notable exceptions for health. And those types of materials, when feasible, you need to consider whether it makes sense for your business to provide those to your employees. And certainly, hand sanitizer abounds. And then if we could publish the poll results, that'd be great. And then I also just wanted to remind you that there's many posting requirements. Some of them are state mandated posters, as you can see here. Others are local posters, so you really want to make sure that you're checking. For example, here we have King County and Seattle. And then additionally, many counties have developed signs that are not required, but are a great resource for free materials. So make sure you're checking on the website, and check frequently because they are updated all the time, so that you can use these materials for your business without expending any cost on your end. The big picture strategy with being practical is making sure that you are prepared and that you remain flexible. As we talked about earlier, so much of this can change quickly. As part of your plan, you need to have a plan to roll back, whether that is rollbacking because you now need to furlough additional employees, or also how you're going to manage staff flows if people have to take additional time off, whether that's to care for someone who is sick or that they have childcare obligations, for example. And if we can learn anything from when we all went through this a couple of months ago, that taking the lessons learned about what it is that you already put in place for remote work and other elements to ensure that if you have to take those steps again, you can do so quickly without any hair on fire approach. And likewise, it's really important that you have a communication strategy, both internal and external, to make sure that your messaging follows your business needs and is compliant with all the local rules. And with that, I'm going to pass it over to my colleague, I believe this is Shireen Wetmore, will be discussing with you accommodations.
Thanks, Chantel. So now we're going to talk a little bit about accommodation, screening, picking who it is we're going to bring back to work. But we're going to start this section off with a quick poll. So you'll see the question up on your screen. Are you allowing some employees to elect to continue remote work for a longer period? Yes, if they wish. Yes, if they have childcare needs. Or no, we need them to get back to work. So that poll is live, and for those of you who are viewing in full screen mode, you'll have to go to reduced screen mode, and you should see the question on the bottom right-hand side of your screen. So while those answers are coming in, we know from our earlier poll question that many of you, about 23%, indicated that you are partially open already, which indicates that you're probably implementing a phased or a staggered reopening. When you're making your return to business plan, you want to first determine which of your employees to bring back and when. And for a phased reopening, this may mean prioritizing the return of employees whose work cannot be performed at home, or maybe particular departments or even floors if physical limitations impact your strategy in the space where your workers will be performing their work. So let's take a peek back at our poll results so far. It looks like about 67% of you so far have said you are allowing some employees to elect to continue remote work for a longer period. But that means for many of you, you're going to need a more coordinated approach or plan in determining who it is that you're going to bring back and when. So pick your pod. The EEOC has issued guidance regarding selection of employees to return to work. For those of you, for example, that said yes to number 2, yes, if they have childcare needs, we got about 20% of you. That was a little bit of a misleading part to our question. And we want to give a word of caution here because even the best of intentions can get you in hot water. And there's a seminal case on this issue, which is one where an employer was forbidding pregnant women or women of childbearing age from working in a position with exposure to lead. And even though it was for arguably the right reasons, it was found to be unlawful. And so it's just a word of caution to resist the temptation to use any criteria, even with the best of intentions, that can implicate protected characteristics or classes or that may disproportionately impact specific sectors of your employee population. You want to set neutral criteria, review those results to ensure that you're not inadvertently adversely impacting a particular group. But of course, many are asking, well, what if my governor says that people over 65 or with certain conditions need to continue to stay at home? Even so, membership in a particular protected group should not be your criteria, your sole criteria for determining whether an individual is selected to return. But as you can see from the second bullet on this slide, there are implications for potential accommodation needs. So executive orders like the one in Washington, for example, that requires accommodation of certain elderly or certain individuals with certain medical conditions may impact your traditional analysis of whether an employee's condition qualifies as a disability for the purposes of engaging in the interactive process and providing reasonable accommodations. And we flag this here because the same ADEA, ADA, FEHA, and other state rules are still going to apply. You're still going to be using your same interactive process, still working with employees to determine whether reasonable accommodations are necessary. But as you're working through the plan that Chantel was discussing earlier, you want to consider that there may be some new or additional needs implicated either by changes to your workplace or by changed conditions for your employees. And some of these hot topics right now are things like anxiety or other mental health conditions that may be triggered by the current events, or unique challenges that your workforce never faced, like latex allergies. So you just want to keep an open mind on that front. Another question we get is, will your emergency action plan during the initial shutdown, so the things that you did as you were quickly, rapidly, sometimes without any notice, shutting down your operations, impact what is now considered reasonable? Or, to put it another way, must an employer now permit everyone to work from home indefinitely? The EEOC guidance says no. Temporary work from home during the pandemic will not necessarily be determinative of whether work from home is a reasonable accommodation, but employers should consider whether these work from home choices that you made during the shutdown, how those will impact what is a reasonable accommodation going forward. And you want to make sure that you're documenting carefully the effectiveness of your temporary work from home measures. But we do want to flag that if, for example, during the shutdown, an employer permitted work from home with the elimination of certain essential functions on a temporary basis during the shutdown, due to your rapid adjustment to a non-work from home environment, those do not necessarily mean that you have to eliminate those essential functions of the position for the purposes of determining a reasonable accommodation. Again, ADEA, ADA, FEHA, all of those rules still apply the way they did before. But on the other hand, for those whose duties have changed, as you're restructuring your workforce, developing new practices, as you develop your reopening plan, you may want to consider revisiting whether your job descriptions accurately reflect the current or new going forward job duties and essential functions of the positions that your employees hold. And finally on here, we have the question that's on many folks' mind: what do you do if an employee refuses to return to work? So we've discussed a little bit that choices about not wanting to return to work may have something to do with accommodation, and employers do have their same obligations to engage in the interactive process. But we just want to remind you that all of your tools in your toolkit still exist. So your disciplinary policies, all of those policies still exist, and you have the ability to discipline or terminate employees under certain circumstances who refuse to return to work. So with that, I'm going to turn it over to Elizabeth to talk about, once you've figured out who you want to bring back, how do you determine whether they're fit to return? Elizabeth?
Thanks, Shireen. So piggybacking on some of the issues that Shireen addressed, one primary question is just figuring out if employees actually can return. There's a possibility that wherever your business is operating is subject to maybe looser restrictions or different orders than where an employee is physically located. You may need to work through some issues as things slowly reopen. Again, I think Chantel said that you'd hear this a million times, but I can't stress enough how important understanding the local orders that impact your employees and your businesses are. So if you can have people, if people are actually allowed to return to work in terms of the stay-at-home orders, you want to make sure that before you bring people back into the office or bring more people back into the office, that those people are able to safely return, in the sense that, they're not currently, potentially have COVID-19, or, make sure that they haven't potentially just been exposed. Again, there are local orders that can provide different guidance on this. There is different industry-specific guidance. For example, healthcare workers are going to have a different standard for fitness to return to work than, for example, perhaps manufacturing. And the EEOC has issued some guidance that impacts that gives some really helpful information for employers in terms of, what can we do? Can we require COVID-19 testing? Can we implement these certain measures? And so, for example, COVID-19 testing itself, the answer is sort of yes, but it depends. It needs to be done appropriately. And the EEOC has started to provide very helpful guidance, and it changes very, very frequently. As Shireen was discussing the issue of bringing employees back that may be part of a vulnerable population, the EEOC actually released guidance on that topic and then took it down and then reposted revised guidance. So some of these things can really change on a daily basis. And with that, we will move on to the temperature check question. I know this has been a very important question. A lot of people are wondering what everyone is doing with respect to temperature checks. And I think the options really, as it's laid out here, yes, we're doing them on site, or yes, we're doing it, but employees need to test or screen themselves at home, or yes, we're doing this with a third party, or no, we're not implementing temperature checks. And with respect to temperature checks, there are, again, a lot of very specific issues to consider. You want to look at your specific industry. You want to look at your specific office layouts. You're going to want to look at whether local orders are either recommending or potentially requiring different types of screening. If you've got, your own employees doing the screening, are they trained? Do they have masks? Do they have gloves? How are you keeping any records? If you're keeping records, what types of records? What are you doing with them? There are just a number of issues that you'll want to walk through to make sure that you have the best process in place for your particular workforce, for your particular facility. And some of this is, I think we were discussing some real nuts and bolts things, like if you have an elevator in your facility. I mean, just looking at your environment and how this will best impact, how this can best be implemented in your environment is really an individualized thing. And if we can publish the results for 4, and we'll move on to 5. Another hot topic is whether employees are being required to wear masks or bring their own. I know, again, local orders may provide guidance or requirements on that front, and employers will just want to make sure that they're doing what is best for their workforce and what is required. And I will jump ahead. So just to briefly recap, temperature taking and masks, there are just a number of issues that you want to consider: potential notice requirements, potential accommodation issues, and for example, if some employees perhaps are unable to wear masks or may have issues with temperature checks, you'll want to make sure that you have something in place to handle any kind of potential accommodation issues that may arise. You'll want to make sure that employees know who the right point person is to go to address these issues. And I think the results now on the temperature checks have been live. It looks like 31% of people are doing them on site, 18% are doing them at home, and 4% are doing tests with a third party, and 46% are not doing them right now. And so with that, I'm going to hand it off to Chantel.
So it's not just employees that we have to protect, but also the members of the public that we're welcoming into our locations. So we really also need to think about what are the public accommodations that we need to be making. And so right now you should have a poll question live about whether or not you're planning on screening your customers. So things about a public accommodation is that you have to remember that the ADA doesn't just apply to employees, but it applies to visitors as well. Now, there is a legitimate safety requirement defense, meaning an exception, if you will. And that means that if it's necessary for a safe operation, then you can require something, but it needs to be based on actual risks. And of course, not surprisingly, not based on any kind of stereotypes or generalities about people with disabilities. And really what we're worried about ADA compliance and making sure that you have a plan in place of both making sure you have a process of how to ensure ADA compliance and also providing training to your employees so that they know how to interact with customers that perhaps don't want to comply with the rules that you've put into place and may have ADA reasons for doing so. You need to start thinking about how it is that you're going to be screening for COVID symptoms. And in particular, also the local ordinances and then state rules regarding face masks and things of that nature as part of the social distancing protocols. What are you going to do when you have a customer that refuses to wear a mask? How are you going to be able to assess whether or not it's due to an ADA reason versus simply just a desire not to comply with the local ordinances? So when you're going through creating your plan, as I mentioned earlier, you want to start thinking about, in order to enact your social distancing rules, do you still have accessible routes into your facility? For your waiting customers, sometimes it's very hard for a customer to stay standing for a long time. What kind of support systems do you have to ensure that they can have seating, but also having a cleaning mechanism in place to ensure that that shared seating is both distant and also clean? And then also with masks, there's so many issues in terms of medical conditions, as well as part of your, for example, deaf community that needs to be able to see people's lips in order to adequately understand what they're saying. And also, I would say that you want to take a good look at your website during this time, because we have so much more virtual shopping and interfacing with your information, and you need to ensure that your websites are compliant with closed captioning and things of that nature so that they are compliant with the ADA. We are actually going to be having a webinar at Seyfarth tomorrow on these issues, and our ADA team will be going into in depth, and I encourage you all to attend. And with that, I'm going to be passing it off to Tim Hoppy.
Thanks, Chantel. You got Shireen first, and then Tim's going to jump in. We're going to both talk a little bit about wage and hour. So we've got two poll questions that we're going to open for you guys right now. Are you changing shift times to avoid overlap during lunches and breaks? And then another question, are you closing your break and lunch spaces? So those will be going live shortly. And while you're filling those out, I want to make sure to read out the CLE code, the best part of the whole thing. So the CLE code is SS, as in Seyfarth Shaw, 8869. That's SS, as in Seyfarth Shaw, 8869. All right, so we'll let you guys answer those poll questions. And briefly, just want to flag a few potential wage and hour issues. We know we're in the Western Pact, so there are a lot of additional, shall we say, requirements on employers, and we just want to remind everyone that some of the considerations that people are bringing in their return to work plans may have implications for wage and hours. So on your screen, you'll see reductions and incentive or hero pay. Employers are increasingly thinking about different ways to respond to either the economic impacts on their business or potentially employees' reluctance to return to the workplace. For some, that means there's going to be a reduction in pay. For others, enticing workers back is going to require some creative incentives. Think implementing return to work bonuses, temporary or permanent wage increases, and other unique changes to employee compensation like commission plans and structures. So while you're thinking of all these things, in addition to putting on your creative hats, remember that you're in the Western Pact. No good deed goes unpunished. So you want to be careful to ensure that you're considering the possible impacts of these changes. For example, reductions in wages may impact the classification of your workers. So you want to consider whether a proposed reduction in pay will bring your employee below the salary basis. And if you need to potentially temporarily reclassify some of your workers as their duties change, which Tim will talk about a little bit in a moment. We also want to flag regular rate considerations. In Washington, for example, your paid sick leave needs to be paid at the quote-unquote normal rate. So considering the changes that you make to your incentive pay, you want to factor in whether that's going to impact the normal rate for example, paid sick leave purposes, which in certain circumstances will have a 90-day look-back period. So just want to keep those in mind. For notice requirements, twofold. You want to consider whether the type of incentive or pay scheme that you're considering implementing will have a notice requirement triggered by your local or state rules, or if you are increasing pay and then planning to do it on a temporary basis, will you be required to have a notice period before you can return those wages to their normal state? And then, of course, don't want to forget that your minimum wage and all your other labor code and other state and local statutory requirements still apply. Tim.
Thanks, Shireen. This is also a good time to think back to our Classification 101. Excuse me. Shireen mentioned the salary basis test and how it's important for us to make sure that our exempt employees meet that test. But the second part of the exemption is duties. And as employees come back to a very changed landscape, there's a chance that our exempt employees are going to be responsible for doing a number of non-exempt tasks, whether that's cleaning and sanitation to comply with state and local orders, or to cover non-exempt tasks for hourly employees that are furloughed. It's important to look at what non-exempt duties our managers and exempt staff are doing, because the primary duties test in California, Colorado, and generally requires that at least 50% of an exempt employee's time be spent doing non-exempt tasks. So when an employee is coming back and is going to be assuming a bunch of non-exempt tasks, there's a risk that the employee could fall outside of the primary duties test and risk the exemption that's exempting them from overtime in California's labor code laws. Now, some employers have asked, well, this request is only temporary. Is it really that much of a risk? If these additional duties are only temporary, is it really that much of a risk? And I think the best practice is to always check the duties of your exempt employees and to make sure that they're performing at least spending at least 50% of their time performing not exempt duties. That being said, the FLSA does have an emergency exemption, which allows managers and exempt employees to perform non-exempt tasks in emergency situations. The problem with the exemption is that it is not, the law is not built out around it. What constitutes an emergency isn't defined by the law, and nor is how long an employee can perform these emergency tasks. So it's an exception that is not something that is very clear at this point. So that's just to make sure that our managers and exempt employees are meeting the duties test when they come back to work. Next, I want to talk a little bit about transitioning back to the office. Some employees might be coming off of furlough and starting to work from home. And for these employees, it's just important to make sure that our work from home policies are clear, particularly for non-exempt employees. A lot of the wage and hour issues and the off-the-clock risks for non-exempt employees working from home are pretty high. So it's a good opportunity for employers to double check their policies, to remind employees of their reporting policies and clocking in policies, and to remind and put in place a plan to ensure that these employees are following the policies. It's also a good opportunity to look at reimbursement issues. Some states like California require reimbursement for expenses incurred while carrying out for necessary expenses incurred on behalf of the business. So it's a good time before bringing back employees to make sure that those reimbursement policies will reimburse employees for the tools that they're going to need to work at home. And then tips for returning employees to the office. This is an opportunity where we want to make sure that returning particularly non-exempt hourly employees is done on a very orderly basis. So what does that mean? It means double checking, confirming that employees have, for example, returned all of the equipment that the employer provided them. For non-exempt employees, this is important because we don't want them to have computer equipment at home, because it might allow them to perform off-the-clock work that could lead to a wage and hour claim later down the line. This is also a great opportunity to confirm with non-exempt employees that their time records were accurately kept when they were working from home, that they received their meal breaks, that they received all of their reimbursements, that their vacation, sick pay, and PTO is up to date and matches what they used versus what's available, and confirm the amount of other statutory leave that they might have. A good practice could be asking employees to verify that the information the employer has is correct and that they received all of their pay and benefits while they were working from home. This isn't a surefire defense, but it certainly could help if the employer were to turn around later and argue that they indeed had worked off the clock. So with that, I will pass it back to Shireen.
Thanks, Tim. So just one more quick slide in the wage and hour category. Two important questions. Do I need to pay for that? And what about meal and rest breaks? In the Western Pact, particular importance in these areas. We've just got a couple of questions on this slide to trigger some thoughts that you want to think through as you are working on your return to work plans. We see from the results of our poll that 54% of you are removing lunch or rest areas, and 48% of you are changing schedules. So you just want to make sure that you're thinking through, do your new policies and practices mean more compensable time? Here we're thinking about all the different things that you're going to be implementing and whether any of those are creating time that under your state or local ordinances need to be compensated. So all of your temperature screenings and assessments, new trainings that you're doing, whether remotely or in person, Chantel was talking about, different certifications that people are doing, assessments they're doing with their work at home equipment that Tim was talking about, pulling all this together, thinking about all the different things that you're adding in and asking your employees to do. Make sure that you're thinking through whether that's going to result in compensable time. And what strategies are you going to use to monitor and ensure that you're efficiently and effectively reducing abuse of that time, for example. And then briefly, we just want to touch on breaks. All of your meal and rest period requirements still exist. You still want to be thinking through, in California, for example, are you getting your meal before the 5th hour? If you're scheduling meal and rest breaks, you don't want to forget about the local ordinances. In LA, for example, employers need to provide time for employees to wash their hands every 30 minutes. So if you're going to be scheduling in breaks and lunches and trying to stagger them because of closed lunch areas and break rooms, you want to make sure that you're including time to account for those additional breaks that need to be woven in based on your local requirements. And then the rest of the ones on this slide we've talked a little bit about in Chantel's section as well, but just want to remember that your social distancing plans also have implications for wage and hour, and some of these efficiencies that you create with your one-way hallways and other adaptations, they may ultimately lead to things that you want to keep because they are more efficient for your pay purposes and for scheduling your shift times and transitions. So with that, we're going to pass it right back to Elizabeth to talk about sick leave.
Thanks, Shireen, and I will go through this very quickly. This is a very nuanced topic. There's no way to go over all of this in detail in I know we're a minute over, but very briefly, if you've got the Families First Coronavirus Response Act, that is going to trigger paid leave obligations in a lot of instances. If you've got 500 or fewer employees, you may be able to have a small business exemption for 50 or fewer employees. But basically, this is going to provide or make paid leave available for a number of employees for childcare-related reasons stemming from COVID, from many different types of COVID-related reasons. The Department of Labor has excellent FAQs that can really help provide some guidance on a number of very, very nuanced issues. There I think are some outstanding questions still, but it's a great place to start if you've got specific questions about intermittent leave or how exactly the rate at which certain types of leave needs to be paid. It's a great starting point. And again, can't stress this enough. The many states and local cities and counties have attempted to close the gap. So for employees that wouldn't be eligible for federal paid leave, many local areas have basically tried to take matters into their own hands and extend it. Creates a bit of a patchwork. It's particularly complicated in California. If you'd like to be very generous, that you can attempt to do the best version possible of a one-size-fits-all, but within, for example, within California or within a specific region, but you're just going to need to make sure that you're looking at what's going to apply to your employees, especially in certain cities. And with that, I'm going to hand it off to Helen.
Thanks everyone for staying with us. Thanks everyone for staying with us as we run a little bit over time. But we have one more question, and if you have time, we'd appreciate you answering this question by putting it into the chat box, which is in the question and answer section. While you fill it out, we have a list here to some of our many COVID-19 resources that Seyfarth has available. If you have not seen our website with some of these resources, we encourage you to take a look. And we really appreciate you taking the time out of your day. Please feel free to contact any of us if you have any further questions or if you have anything that you'd like to discuss in further detail. Stay safe, everyone, and thanks for being with us.